Perfect. So we should have our attendees joining. We'll give it a minute. Apologies, everyone, for starting a few minutes late. We were having some technical difficulties, as always happens on a Monday and with technology. I know we had some people in the waiting room, and I see people coming in right now, so we will get started. Well, I'll just get started with the introduction now, since I know there's a lot to talk about today. As people are coming in, it looks like we've got a good crew. My name is Renee Stromsky, and this is the Ohio Special Education Legal Clinic. We are a collaborative between Abdenor Weicker, Disability Rights Ohio, the Ohio Coalition for the Education of Children and the Ohio Coalition for Children. Oh my goodness, I can't talk. I'm sorry. And the Ohio Coalition for the Education of Children with Disabilities. I am so used to saying OCECD, which is a lot easier. We are a clinic that offers monthly virtual workshops that are an hour long on different special education or disability related topics, followed by individual guidance sessions with our attorneys and advocates that are 30 minutes long. You can sign up for future individual guidance sessions and workshops at our website, which is lawyers4students.com/legal clinic. We typically are on the third Monday of every month from 12 o'clock to 1 o'clock, and our individual guidance sessions are between 1 and 3 p.m. Usually I will tell you what topic is up next month, but we are going to take a short hiatus because we are on our last presentation of our 2024-2025 series. So we are going to regroup, and we will be back for you all in October, but we will be posting our new workshop series in early September. In the meantime, we have Amy Clausen here with us from Ohio Family to Family, who will be presenting on planning for healthcare needs and insurance options for adults with special needs, or planning for future healthcare needs in adulthood. We do have closed captioning available for participants. We also have our Q&A that we ask you to use if you have any questions. Amy has a couple slides. She'll pause after the different bigger sections of her presentation for a question opportunity, and then I will read those off to her, and she can respond. If there's anything that I can answer in the meantime, I'll be monitoring the Q&A for that as well. And then at the beginning here, as Amy is introducing herself and talking a little bit more about where she comes from and what she does, I will be submitting a poll for our attendees, just so we can gauge what kind of information or knowledge you are all looking for. And so Amy can kind of hit on those points a little bit more in this presentation. So Amy, thank you for being here. We really appreciate it. And I will turn it over to you to introduce yourself and put that poll up right now.
Great. Thank you so much, Renee. Happy Monday, everyone. I am hoping to get some more information about who is joining us today. Please let me know what kind of insurance, healthcare, information you are hoping to learn about the most today. I'll give you
Amy,
just
can
a
you see
minute.
the responses to this poll?
I cannot.
You cannot, okay. Well, so far we've got 2/3 that are going towards Medicaid and 1/3 towards private insurance. So it seems like the majority is Medicaid, but still some
Okay.
interest in private insurance, and nobody yet has said other.
Okay. So this is really good, you guys. Thank you, Renee, for creating that poll for me. And there I see the responses now. So this is good. We are aligned in our vision for today. My name is Amy Clausen, as Renee said, and a little bit of background about me, which I think will help most of the audience. I am first and foremost the parent of an adult son with a complex disability. So what does that mean today? That means for the last 28 years, I've been helping him have the best health care as possible. And I do that through a lot of service systems that we have in Ohio, and both private insurance when he was younger, and my husband and I had to figure out when to take him off of private insurance and go with Medicaid. We also used complex medical help, which is coined CMH in Ohio. I'll talk about that for just a few minutes later. But I wanted you to know that my role in helping Ohio's families has been part of my breath and life's work for the last 27 plus years. So this topic is very near and dear to me, and I hope you get as much out of it as we wanted you to. So with that said, I am going to let you know that I am also the program coordinator for Ohio Family to Family. And I support families in Northeast Ohio as the family support specialist. Two of my colleagues are in Central Ohio and Southern Ohio. We all do this work on behalf of Family to Family. We also have a sister program that's free as well, and that is called Ohio Parent to Parent. Both programs are statewide, and we are here to empower families who have children, youth, and young adults with special health care needs, to help you be educated, empowered, and supported, because you are the constant in your child's life, no matter what age they are. So that is very important to us. So we sit within the University of Cincinnati Center for Excellence in Developmental Disabilities, and we do our work throughout Ohio based on a four-pronged approach. One is community collaborations, one is research and policy, another one is training professionals who want to learn more about developmental disabilities, and another one is information sharing. We are sharing information today, and we collaborate with community partners like today through DRO and OCECD. We don't help families alone. We always work with partners, and that's what I love about this work. Um, so through the USAID, of course, we are here to improve the health and self-care, respect, treatment, and self-determination of all individuals with disabilities and their families. So if after today you want to reach out to me or anyone at Ohio Family to Family and P2P, you can use this QR code to access our intake form. Again, we're free. We provide one-on-one assistance. We help families apply for state and local programs, give guidance on resources, help you communicate and advocate more, support and connection with peers, et cetera, and lots of training. Here's who the four of us are, and we hope you will reach out to us. Just a shameless plug here today, real quick. We have our booster session series throughout the year. Our next booster session is on creative caregiving options and how to support your adult child with long-term care needs. So it's a little bit related to today's topic, but we're going to delve into services on the IO waiver, self waiver, or level one waivers, part of that HCBS or home and community-based services topic. So please feel free to check us out and get registered. Okay, so the purpose of today is focusing mostly on private insurance options, how to navigate that, the wide world of Medicaid programs that our loved ones can access if needed, and the complex medical help program, CMH. We'll touch on that. And then I'm going to sprinkle in other considerations when you're looking at changing doctors, when your child needs to change doctors into adult health care. And then I'm going to give you a couple of other resources that will help you with health insurance. A word of caution, this is just an overview today. This is a big topic. It's very complicated, but very important topic to many families that we work with. And also note that although I want to help everyone, we can't address personal details on this call today or individual and specific questions. But don't worry if we can't answer your questions today. We'll be happy to talk with you privately, or you can reach out to us. So acronyms, don't forget these acronyms, right? DODD is Ohio Department of Developmental Disabilities. ODJFS, Ohio Department of Job and Family Services. ODH, Ohio Department of Health. ODM, Ohio Department of Medicaid. And HCBS, that's a big one for our kids. And I say our kids, even though some of them are adults. Home and community-based services. If you want alphabet soup, a guide to those acronyms, check out the resource I've listed on the slide. So let's get started. It's 12:15. I'm going to watch my time and I'm going to pause for questions, and Renee and others will help me answer those and watch the chat. So a couple things about private insurance. If you have private insurance, this is your low-hanging fruit for your loved one. It is critical that you understand the plan and benefits, what's covered, what copays or deductibles are, and whether or not there's a maximum number of therapy visits, or if more can be requested if needed. You should also know who to call in your human resources department. That's if you have an employer-sponsored private insurance program. Usually that's yourself or a spouse or someone who's employed by a company or entity that provides your employer-sponsored health insurance. You can possibly change plans if needed as your loved one gets older or has changes in medical needs. That's something to consider. Don't be afraid to appeal denials. We get this a lot at Ohio Family to Family. You can appeal denials from private insurance and ask for exceptions. You can explore secondary insurance plans like the CMH program and Medicaid. Sometimes, if there's an autism diagnosis, we would recommend you join networks such as ASD Ohio to learn about specific behavior therapies such as applied behavioral analysis, ABA therapy, other coverage options, and more. Also, This is something that many families who don't have adults yet need to know about. Private insurance for our disabled adults can possibly remain on your private insurance after the age of 26. There are some things you need to know about how to go about this. And this isn't one size fits all either, so please be aware. How long can my adult disabled dependent stay on my plan? That's what you need to know from your private insurance company. Most of the time, they can stay on the plan for as long as they would be able to if they were under 26. Usually, this is as long as the parent has the plan, but some disabled dependents can continue under a retiree's benefits. Okay, so it gets a little complicated. Important to note that some insurers may only approve the coverage for a limited period and require a new application or review of the disability determination to continue coverage. Especially an adult who's a disabled dependent who receives Ohio Medicaid can continue also having private insurance. This is really important. In general, the private insurance is the primary plan, and Ohio Medicaid is the secondary plan once your child becomes an adult and is eligible for Medicaid. Okay, so I know that's as clear as mud, but these are tips on the slide, and I want you to take note. Always go to your private insurer and request an extension due to your child's disability beyond age 26. It used to be when your child was 25, you had to get ready to boot them off and go to Medicaid. That's not always the case anymore. Health insurance marketplace is another type of private insurance. You should try to take a look at that. Your young adult or any adult or child can possibly get insurance through the plans offered on the website. Plans and pricing. If you don't have health insurance through a job, Medicare and Medicaid, or another source, you can get coverage for plans. Again, if you don't have access to other health insurance. These can be a lower cost plan. You can get tax credits, and they will cover pre-existing conditions. But all plans offered will cover a pretty vast amount of services like outpatient care, emergency services, hospitalization, pregnancy, newborn care, mental health services, et cetera, et cetera. So don't forget to look into those. Questions so far? Again, meat and potatoes is going to be about Medicaid, so I want to make sure.
There are no questions in the Q&A right now, and I don't see any coming in. So it looks like you're doing
Okay.
it, and I appreciate the way you're explaining it. So I think you're doing a good job, and I'm sure we'll have a couple more come in once we get to the meat and potatoes.
Okay. Okay, good. Thank you, Renee. Okay, so here we go. We're going to dive in deep, or as deep as we can today. It's an overview. These are the questions on the types of Medicaid for adults that we often get the most of. So if you're looking for information on Medicare today, we're probably not going to cover that. Types of Medicaid in Ohio. Before we talk about that, you need to know that it's a public health insurance program for adults, children, pregnant women, elderly adults, and people with disabilities. It's been around since 1965, so interesting fact. There are many, many ways that people can enter into Medicaid. It's very complicated, but these are the most common that we have families ask us about. Please remember, Medicaid offers different programs, different services, depending on the types of Medicaid a person is eligible for and their particular medical needs. There's a website here I have listed on the slide. Take a look at that for more information. So, in Ohio, SSI recipients automatically are enrolled in Medicaid. Interesting to think about when our children become adults. Managed care is a type of Medicaid that offers care coordination, but these plans have a limited list of doctors and facilities you can go to that are covered within the plan. My Care Ohio is for people who are covered by both Medicaid and Medicare. Long-term care is for people who qualify for facility or home and community-based services. We'll get to that in a minute. Mentioning Medicaid buy-in. This is a program that offers health coverage to working people with disabilities in Ohio who have too much income or resources to qualify for standard Medicaid. To get Medicaid buy-in coverage, you do have to pay a monthly premium, but that could be good for someone who's a young adult and still wants to work, or an adult who wants to work. Medicare. Again, this is probably all you're going to hear me talk about Medicare today. It's federal program that provides health insurance for people who are 65 and older or who are under 65 and have disability. After a person gets Social Security disability insurance, again, SSDI, for 2 years, that person can qualify for Medicare as well. We'll talk more in a minute. Here are the different ways people in Ohio refer to Ohio Medicaid. All four of these are terms you might hear, but they all mean Ohio Medicaid. I'm not going to review them, but to be eligible for Ohio Medicaid, you have to be an Ohio resident, you have to have a Social Security number, be a U.S. citizen, meet citizen requirements, and meet the income and financial limitations and requirements. Okay? So keep in mind, all four of these terms refer to Ohio Medicaid. This is a chart that we created last year. If you like visuals like I do, this may help you understand all the programs that mostly we need to know if we have a loved one who may be eligible for Ohio Medicaid. So I'm not going to cover all of these programs, but I wanted you to see it in a color-coded way that you can study on the slide at your leisure after today. What we are going to go through are these sections. Ohio Medicaid is a health coverage program in orange. We're going to talk about the health coverage and the long-term care. So, two types of Ohio Medicaid: fee-for-service, which is the traditional Medicaid. It pays for healthcare providers who are directly Medicaid providers, so it pays them directly. There's no cap, there's flexibility, and it can be for anyone of any age or health condition. However, managed care, this is the distinction, it's a fixed monthly fee paid to a managed care organization as insurance. And it's insurance for each person enrolled. Managed care organizations manage and coordinate the care for the person, and it's based on a fixed payment model, so they manage their costs. And you have to stay within a network of providers. Okay. So in Ohio, most people who have Medicaid must join a managed care plan to receive health care. There's a small caveat to someone who has a home and community-based waiver. There's an exception there. But for now, we're talking about managed care. There are 7 managed care organizations that you can choose from. It's important to check with the doctors and specialists that you use or your loved one uses to make sure they're on one of the managed care programs that you may be considering. So go to the website, ohiomh.com, to find out more about each individual plan and what they entail. And you can always reach out to others that you know to walk through it with you. MyCare Ohio. This is a system of managed care plans that are supposed to coordinate physical, behavioral, and long-term care services for individuals that are older than 18 and who are eligible for both Medicaid and Medicare. Some points to know is that Medicare is federally funded. Medicaid is covered by both federal and state funding. Medicaid pays for the long-term care portion. Medicare does not. So, how do people with disabilities become dually eligible? Usually, we find that when a parent passes away or retires, the adult child with a disability gets SSDI. Okay. Then, after that 2-year mark, they become eligible for Medicare. Hence, that's when they become dual eligible. Okay. So say your adult child or your child already has Medicaid, your spouse or you retire, your adult child has already been receiving SSI. Once you or your spouse retires, they can then draw on that retirement they've paid into and now collect SSDI. And I say they, to clarify, I meant you or your spouse. Some of our kids have never worked, so have never paid into the system. But when we retire or die, our disabled child can possibly get SSDI. And then 2 years after that, get dual eligibility. You can check out that My Care Ohio at your leisure. So let's talk about long-term care. Remember that Ohio's Medicaid program helps Medicaid eligible Ohioans pay for long-term care. There's 2 ways of paying for that: through home and community-based services, which offer individuals with long-term care needs the option of receiving services at home or in a community setting or in a facility. These programs serve a variety of populations, populations, including individuals with intellectual or developmental disabilities, physical disabilities, or mental illness. Individuals who cannot care for themselves at home may need services through a facility-based setting, such as a nursing home or other long-term setting. So either way, some of the healthcare services that are important to know about are these on the list on the right side. Okay, so remember the chart, and I'll pull it up here in a minute. Home and community-based services and facility-based services. Personal care assistance could be covered. Skilled nursing, physician's visit, prescriptions, medication management, mental health counseling, and find out more using the links that I've added to the slide. So again, here's the chart I shared earlier. But this is where we focused on the HCBS and waivers, home and community-based and waivers. So the green boxes now are the developmental disabilities waivers. There are other waivers, such as Medicaid waivers and waivers for elderly. Those are on the left side of your chart. A waiver waives the person's right to an institution, hospital, or intermediate care facility. Waivers are another way to fund your child's therapies, medical equipment, and other long-term care needs. Waivers also waive traditional Medicaid laws. They waive the family and household income and include a special Medicaid workaround to do this, and therefore fund long-term services. So people who have waivers must meet certain levels of care and income and resource limitations. Keep that in mind. As a person, not as the family. So again, remember that term, waivers, waive Medicaid laws, waive the household income, and often waive the person's right to an institution, hospital, or intermediate care facility. Okay, so the dark blue programs on this slide are managed by Medicaid directly versus the green ones are managed by the developmental disabilities system. Here's all of the ways to receive Medicaid waivers, DD waivers, and elderly waivers in Ohio. It's daunting, but I like this chart because it gives you a visual of all the waivers in Ohio. Again, when we're talking about home and community-based services, this is important when you're talking about Medicaid and health care. So there are 8 home and community-based waivers in Ohio. I'll let you read through what each waiver can do. And there's a link at the bottom. It's old, it's from last May 2024, but it's still relevant, again, to give you that picture of waivers and how they can help. And remember that all the waivers come with Medicaid, that traditional Medicaid, and you would get a Medicaid card. Okay, so in order to have access for home and community-based waivers, you'd need to be prepared and contact your county board of developmental disabilities and ask for intake or an assessment based on your loved one's need. Waivers might be one way to meet the needs of a person, but it's up to each county board of DD on the right side, the three waivers on the right side, to determine how to meet the needs of the person versus to get access to one of the other waivers on the left side, you'd need to contact Medicaid. Okay. Questions. We do have a few minutes to delve into some questions. Do we have any, Renee?
Let's see, we had a question. Oh, where'd it go? We had one question just about whether the forms or visuals would be sent out or shared. And I said that they would be, that after the presentation, you would send over your slides and the links that are on those slides, and they would be posted on our website as well as a recording of the session.
Good.
I also did try to find I wasn't able to click the link to the Medicaid waiver chart that you were just sharing. I'm sure it'll be clickable once the PowerPoint is shared. I shared one that I found online, but I think it's a little bit, I just wanted everyone to know that I think it's a little bit older than what you were sharing. It looked like yours were based, you said 2024, and I think this one was back in 2022. So little out of date, the one that I sent.
Okay.
And as I'm talking, I don't see any more questions coming in, which is surprising. So if anyone don't be shy to ask questions for Amy. She's all ears.
Yes, and I realize this is a lot of information in a very short amount of time. So this was really just an overview. Sometimes when we do presentations like this, you need time to let it settle in what how your loved one, your child needs to focus on healthcare in the future. But sometimes you need to focus on what their care needs are. Then that helps drive what pathway you need to go. And I understand that because I have lived experience, but let's keep going nonetheless. This slide is just another link of waiver comparisons and that chart that I shared, but also a new one that can help you walk through Ohio Medicaid. So I sprinkled in this resource slide to let you in all your leisure time as families. For those of you, I chuckle, haha, like we have time. But your valuable time when you're researching online, these are two go-to websites you can use. So let's talk a little bit about complex medical help. I wanted to spend just a few minutes on this because if you have a child with a certain diagnosis who is, excuse me, 25 years old or less, you might want to look into this, especially if your child maybe in the past was not eligible, but they have developed other medical needs. And I just learned last week that celiac disease is a covered condition. So even when you don't see your eligibility diagnosis on the list here on the right on the in the orange box, reach out and ask questions because you never know. So adults are eligible for CMH up to the age of 26. CMH is a healthcare coverage program sponsored by the Ohio Department of Health. We're very unique in Ohio. This is a list of conditions that are eligible. Again, it's not exhaustive, but if your child or your loved one sees a CMH approved doctor for their care for one of these conditions or their condition, you can apply through that provider. CMH is a payer of last resort, so medical bills are submitted to private insurance first, then Medicaid if they have it, then CMH last. And sometimes it is very possible to have all three. My son did, by the way, many moons ago. Um, but CMH is based on financial eligibility, but only for the treatment program. So there's three different programs at CMH. The diagnostic program is available to anyone, regardless of income, who is suspected of having one of the qualifying medical conditions. And once you're approved for the diagnostic program, any costs that fall upon that person or family related to testing or procedures to confirm or rule out the condition will be covered by CMH. So again, that's regardless of income, diagnostics. Okay. For the treatment program, we do need a financial application completed. And anyone who has Medicaid is automatically financially eligible for CMH. If the child does not have Medicaid and the family is determined or the household is determined to be over income, most of the time you can still apply for the treatment program and get a cost share option, which for some people is very, very valuable. Maybe you pay for half the year and then the rest of the year is covered. It can be helpful. The other main program of CMH is the hospital-based coordination, and it's just like the diagnostic program, and there's no financial component to this. So families who have children or adult children with a qualifying diagnosis can be referred to service coordinator at a hospital or local public health nurse to develop your plan. Wanted to make sure you knew about that. Questions? I'll keep going if not.
No questions. You're doing great.
Okay, good. So the rest of these slides are really more food for thought and online resources. Some of them are about health insurance. Some of them have a little bit more about it. But when I talk to other families about health insurance, we usually talk about healthcare transition and moving into the adult healthcare realm. So maybe you'll find this extra information interesting. So there's an online website that I'll share with you in the next slide that covers all 6 of these topics on the left. For your loved one who's maybe still in high school, still trying to figure out their way to becoming an adult, don't forget about healthcare transition goals at school as well and in their IEP and 504 and at home. Help them understand healthcare. Help them understand their health, their healthcare routines, leading their healthcare visits now when they're still with their pediatrician. Help them be as independent as possible and understand their legal rights and how those change. And planning for the move to adult healthcare cannot be started early enough. Talk to your child's pediatrician. Make sure you check out some of these online resources. They're created in a way that has, let's say, easy to understand materials. There's videos on there and a couple of notes When you decide to make the move into adulthood specific to health insurance, you want to check to make sure that your child's or your loved one's new health insurance is accepted by the new adult doctors. Um, Make sure the new adult doctors accept Medicaid or the type of managed care or insurance that your adult child now needs. Don't forget about releases of information. Sometimes families are locked out of my chart, by the way, and my chart access until they have proper releases made to have access to your child's records. Make sure you think through, is your child going to be responsible for their medical bills? Are you going to teach them how to do that? Or does your child, as an adult, need a caregiver or a support person to help them with those bills? So take a look at the web link I've provided here to check out those resources. Another valuable resource that people don't know about is this one. It's called Ohio Disability Benefits 101. It's a website that can help review benefits and programs that your child, if they have a job or don't have a job, could use, right? And you can see on the picture on the slide, it goes through short video vignettes and information about all the things that may be helpful for your loved one. Um, Also, it's a really cool resource because it has an online estimator that can calculate what benefits would look like given the personal details for your situation that you would actually type into the system. So here's where you can include whether you work, go to school, if you qualify for Medicaid buy-in for workers with disabilities, for example, and how other benefits might work for your particular situation. It can be a really, really helpful resource for you to understand all of that because it's very complicated. Um, Another resource after today as your go-to, if you're still uber confused and you say, hey, I need someone to help me, my spouse, and my adult or soon to be adult loved one with a disability in person. I don't like the online tool. It's not the best for me. The Centers for Independent Living exist all across Ohio. Check them out. They often, not all of them, but some of them, for example, I'm up here in Northeast Ohio. Families that I support, if I can't help them with their benefits, I refer them to LEAP here in Northeast Ohio. LEAP has a disability benefits analysis coordinator who can do that one-on-one consultation to understanding Social Security benefits, um, SSI, SSDI, Medicaid, Medicare, and even supplemental nutrition assistance, SNAP program for food assistance. How all of those impact the child's wages if they have a job, and whether or not they're eligible for federal and state benefits, and overall they get a nice picture of their overall financial well-being, right? So they look at the whole picture. But the Centers for Independent Living could help you and your loved one, um, not just with benefits analysis, but other goals for living more independently as well. So check them out. So it is a few minutes before the top of the hour. I'm happy to take questions, but if you've tuned in today and found that you have an extra moment to give us your feedback, I would love, love, love that. Here's a QR code. And of course, here's my contact information. You'll get the slides, so you'll be able to contact us. This is our QR code to our website. Again, our website link as well. And I hope that maybe you just took one tidbit of information today so that you feel more empowered and knowledgeable. And please don't hesitate to contact me in the future.
Thank you, Amy. We do have one question for you. What exactly does the transition from the childhood to adulthood um, doctor's office visits kind of look like? Are families usually, the question is, are families usually notified when the patient is no longer accepted by pediatric doctors? Does it happen automatically at 18, or is it based on provider?
That's a great question, and I'm very passionate about moving into adulthood, but adult healthcare is something we don't think about, right, as parents. So your last point is what I want to say the answer is. It depends on every doctor's office. What age you might get the boot, in other words. That's why it's up to every family, every individual to talk with their current doctors now. And what I fear is when we hear families say this, which I do regularly hear this, my son's doctor just told me that he can't see him anymore because he's turning whatever, 22, and we can't see him anymore, and his birthday's next month, right? So I hate that kind of a phone call from a parent. Um, it's really working with your current childhood doctors for your loved one and saying, I don't want to wait till it's too late, and I don't want to be in crisis mode finding appropriate adult doctors. So I need your help working with me at the same time and slowly easing into adult physicians. Some hospitals and big clinics do have an automatic cutoff, but they're all different too, and especially with specialties. Some specialties at our larger hospitals will see our adult children forever. Not sure that that's good, but it's up to everyone, right? Depending on your child's, say, some rare conditions. We need to have security and knowledgeable people about that specific condition. And I get that. That's very important to our children's healthcare. So I hope I answered that question.
I think you did a great job answering it, and I don't see any follow-up to that one yet. I will say there are some thank yous in the Q&A, including from Tammy Sebastian. And it takes us right about to the end, which is perfect. Thank you so much for all of your knowledge and for sharing it with us today and for making it so easy, well, as easy as possible for us to understand, given the amount of information there is there and the complexity of it as well. Like I said, this is currently being recorded, and if you give us a couple of days, by the end of the week, usually that recording is posted. And as soon as I receive these slides with all the links and graphics from Amy, we will have those posted as well by the end of the week, for anyone to be able to watch or um, watch again or use those graphics as need be. And I will point out again that Amy on the second to last slide shared a QR code for a link to an evaluation. I know those are important for her to keep doing what she's doing. But thank you so much for joining us today, and to everyone else for joining us this afternoon. We look forward to seeing you again in October after our brief hiatus from the Special Ed Legal Clinic, and we will be back and ready with a new series then. Be on the lookout in early September for a list of those new workshops. And again, we'll see you in October. And thank you, Amy.
You're welcome. Have a good rest of your day.
Have a good afternoon, everybody.